Imagine being told you have cancer. Today, while still scary, there's a world of treatment options, a real chance at survival. But what if it was the 1940s? A time when a cancer diagnosis was almost always a death sentence. The treatments were brutal, often just as deadly as the disease itself. It was a time of despair. But in this darkness, one woman lit a beacon of hope that still shines brightly today. Her name was Dr. Jane Cooke Wright, and this is the story of how she became known as the mother of chemotherapy. Born into a family of medical pioneers, Jane Cooke Wright seemed destined for greatness. His father, Dr. Lewis T. Wright, was one of the first African-American graduates of Harvard Medical School and a distinguished surgeon. Growing up in this environment, Jane was surrounded by a passion for medicine and a relentless drive to challenge the status quo. After graduating with honors from New York Medical College in 1945, she joined her father at the Harlem Hospital Cancer Research Foundation in 1949. At that time, the very idea of using chemicals to fight cancer or chemotherapy was in its infancy. It was a radical, almost unthinkable concept. The standard approach was aggressive surgery or radiation, both of which were crude and devastating to the body. Early chemotherapy drugs were essentially poisons, and doctors had no real way of knowing if a particular drug would work on a specific patient without administering it and hoping for the best. It was a high-stakes guessing game, and patients paid the price. This is where Jane Cooke Wright's genius truly began to shine. She looked at this imprecise shotgun approach and thought, there has to be a better way. Instead of testing toxic drugs on already suffering patients, she came up with a revolutionary idea. What if we could test the drugs on the cancer cells outside the body first? She pioneered a groundbreaking technique, taking a sample of a patient's tumor, growing those malignant cells in a lab, and then exposing them to a range of different chemotherapy agents. This allowed her to see exactly which drug was most effective at killing that specific person's cancer cells. It was the birth of personalized medicine, decades before the term even existed. For the first time, doctors could choose a treatment with a high probability of success before ever giving it to the patient. This single innovation saved countless lives and fundamentally changed the way we approach cancer therapy. It transformed treatment from a shot in the dark to a targeted scientific process. But Dr. Wright's innovations didn't stop there. She faced another major hurdle: how to get the medicine to tumors deep inside the body, like those in the kidneys, liver, or spleen, without poisoning the entire system. At the time, chemotherapy was typically given orally or through a simple injection, flooding the whole body with toxic chemicals and causing severe side effects. Dr. Wright developed another brilliant method. She designed a catheter system that could be threaded through the patient's arteries, delivering a high concentration of chemotherapy drugs directly to the site of the tumor. This targeted delivery system maximized the drug's effectiveness against the cancer while minimizing the damage to healthy tissues. It was a game changer for treating solid, inoperable tumors, opening up new possibilities for patients who previously had none. Her work had a dramatic and immediate impact. Alongside her father, she worked with a drug called methotrexate, which is still used today. Their research and methods contributed to incredible breakthroughs. By the late 1960s, a diagnosis of childhood leukemia, once a certain death sentence, now had a survival rate of up to 50%. That's not just a statistic. That represents thousands of children given a future, thousands of families given hope where none existed before. What makes Dr. Wright's story even more remarkable is everything she accomplished outside the lab. She wasn't just a scientist. She was a wife and a mother to two daughters, Jane and Allison. She balanced the immense pressures of her groundbreaking research with the demands of family life. She was also a talented artist, finding an outlet for her creativity in painting. Her life was a testament to the idea that you don't have to be just one thing. You can be a brilliant researcher, a dedicated mother, a passionate artist, and a transformative leader all at once. And she was a leader. In 1964, she was one of the 7 founding members of the American Society of Clinical Oncology. or SCO, which is now one of the most influential cancer organizations in the world, with over 45,000 members. Think about that. In an era dominated by men, she wasn't just in the room, she was helping to build the room. Just 3 years later, in 1967, she was appointed head of the chemotherapy department and associate dean at New York Medical College, her alma mater. At the time, she was the highest-ranking African-American woman at a nationally recognized medical school. In 1971, she shattered another glass ceiling, becoming the first woman ever to be elected president of the New York Cancer Society. Let's be clear about the challenges she faced. She was a woman in a field completely dominated by men. She was an African-American woman in an era of overt segregation and systemic racism. The obstacles in her path were immense. Yet, she never let them define her or limit her. She met every challenge with grace, intelligence, and an unwavering commitment to her patients. Her expertise was so respected that she was sought after across the globe. She led medical delegations to China, the Soviet Union, and several countries in Africa and Eastern Europe, sharing her knowledge and learning from others. She was a global ambassador for a better way to treat cancer. Dr. Jane Cooke Wright passed away in 2013 at the age of 93, but her legacy is immortal. Every time the doctor takes a biopsy to determine the best course of treatment, they are walking in her footsteps. Every time chemotherapy is delivered through a catheter to target a specific organ, her innovation is at work. She didn't just contribute to medicine. She built entire new wings of the Hospital of Hope. She proved that with ingenuity and perseverance, you can turn a death sentence into a fighting chance and a fighting chance into a life saved. Her story is a powerful reminder that progress is never easy. It's built by people who dare to question, to innovate, and to push against the boundaries of what's considered possible. Dr. Jane Cooke Wright didn't just change cancer treatment, she changed the world. Thank you so much for watching. If you were inspired by Dr. Wright's incredible story, please share this video to help her legacy reach more people. And don't forget to subscribe for more stories about the remarkable individuals who have shaped our world. See you next time.